Did you know that by the time you finish watching this video, more than 30 seniors in the US will be hospitalized for complications directly linked to their prescription drugs? That's one every single minute. But here's the shocking truth. The danger isn't always the disease itself, it's often the very pills meant to protect you. For decades, seniors have been told these medications are safe, routine, even life-saving. Yet new research shows many of them quietly damage the heart, weaken bones, drain energy, and even shorten lifespan. And the pharmaceutical industry has known the risks for years, while making billions from keeping seniors on long-term prescriptions. In fact, a 2023 study published in the Journal of Aging and Health revealed that certain widely used drugs can increase the risk of premature death by nearly 40% in adults over 65. In this video, we'll expose 9 of the most popular medications quietly destroying senior health today. Some may already be in your medicine cabinet right now. And number 3 on this list? It's prescribed for something as minor as indigestion. Yet it can rob your body of the very nutrients you need to stay alive. Before we dive in, I want to hear from you. What medications are you currently taking every day? Have you ever noticed sudden fatigue, dizziness, or strange side effects that your doctor brushed off as normal aging? Drop your experience in the comments. We're reading each one and replying with personalized insights. Now, let's start at number 9. Medication number 9, pain relievers, NSAIDs like ibuprofen and naproxen. Millions of seniors reach for over-the-counter pain relievers every single day, believing they are harmless because they don't require a prescription. Whether it's for arthritis, back pain, or headaches, drugs like ibuprofen, naproxen, and even some prescription NSAIDs have become a daily habit in households across America. But what few realize is that these medications, when used long-term, can quietly erode the lining of the stomach, trigger internal bleeding, and drastically raise the risk of kidney failure and heart problems. A large 2022 study in the Journal of Clinical Geriatrics followed more than 45,000 adults over 65 and found that regular NSAID users had up to a 36% higher risk of hospitalization due to gastrointestinal bleeding and nearly a 20% increase in heart attack risk compared to those who avoided them. Many seniors think of a couple of pills as no big deal, but inside the body, these drugs suppress protective prostaglandins, chemicals that keep your stomach and kidneys functioning properly. Without them, ulcers form silently, blood pressure climbs, and kidney tissue begins to scar. Often the first sign of damage isn't mild discomfort. It's a trip to the emergency room. If you've ever felt sudden stomach pain, noticed black stools, or experienced unexplained fatigue while on these medications, it could be a red flag your body is paying the price. Better tip. If you rely on NSAIDs for daily pain, ask your doctor about safer alternatives like acetaminophen in limited doses, or non-drug approaches such as physical therapy, gentle stretching, or turmeric supplements, which have been shown to reduce inflammation naturally. And never assume over-the-counter means safe. For seniors, these pills can be among the most dangerous. Medication number 8, proton pump inhibitors, PPIs like Prilosec and Nexium. Heartburn, indigestion, acid reflux. These are issues that almost every senior experiences at some point, and for years the go-to solution has been a class of drugs called proton pump inhibitors, better known as PPIs. Prilosec, Nexium, Prevacid, they are marketed as safe, effective, and even gentle enough for daily use. Many seniors end up taking them not for weeks, but for years or even decades, often without realizing the hidden cost. What PPIs actually do is suppress the stomach's natural acid production almost completely, and while this may bring short-term relief, the long-term effects can be devastating. Stomach acid isn't just about digestion. It's critical for absorbing nutrients like vitamin B12, calcium, and magnesium, all of which are essential for maintaining strong bones, sharp memory, and balanced energy. Without these nutrients, the body slowly begins to break down from the inside out. A 2016 study published in JAMA Neurology followed more than 73,000 adults aged 75 and older and found that seniors who regularly used PPIs had a 44% higher risk of dementia compared to non-users. Other research shows an alarming increase in hip fractures, kidney disease, and even infections like pneumonia, because reduced stomach acid makes it easier for harmful bacteria to survive and spread in the body. Seniors who depend on these pills often describe feeling weaker, more tired, or noticing sudden lapses in focus, yet they rarely connect these changes to their daily little purple pill. Better tip: if you're relying on PPIs for chronic heartburn or reflux, don't stop suddenly, but don't assume lifelong use is safe either. Talk with your doctor about tapering down and exploring safer options like H2 blockers. For example, famotidine, sold as Pepcid, which are less likely to harm memory and nutrient absorption. You can also try natural supports like deglycyrrhizinated licorice, which soothes the stomach lining, or simple lifestyle changes such as eating smaller meals, avoiding late-night snacking, and elevating the head of your bed to prevent acid from flowing back at night. Sometimes the smallest adjustments can protect your health far more than a pill ever could. Medication number 7. Bladder control drugs like oxybutynin and ditropan. For many seniors, frequent trips to the bathroom, sudden urges, or even accidents can be embarrassing and exhausting. To manage these symptoms, doctors often prescribe bladder control medications such as oxybutynin, sold under the brand name ditropan. On the surface, it seems like a practical solution. Take one pill and regain control of your bladder. But what isn't always explained is how these drugs affect not just the bladder, but also the brain and overall health. Oxybutynin works by blocking acetylcholine, a chemical messenger that is vital for memory, concentration, and nerve signaling. When this pathway is disrupted, seniors often begin to notice brain fog, forgetfulness, or difficulty following conversations. The danger is magnified over time because oxybutynin easily crosses the blood-brain barrier and directly interferes with the hippocampus, the memory center of the brain. A 2019 study published in the BMJ revealed that people over 65 who took strong bladder medications for more than a year had nearly a 49% higher risk of developing dementia compared to those who did not. Beyond the brain, these drugs can also cause dry mouth, constipation, dizziness, and blurred vision, which all add up to more falls, more hospital visits, and a faster decline in quality of life. Sadly, many seniors are never told these risks. They believe their forgetfulness or mental slowness is just normal aging, when in fact, it may be their bladder medication quietly draining their vitality. Better tip: if you are taking oxybutynin or similar drugs, do not stop suddenly, but do speak with your doctor about safer alternatives. Newer options like mirabegron, Myrbetriq, work through a different mechanism and have shown significantly fewer cognitive side effects. Alongside medication changes, try natural approaches. Limit caffeine and alcohol, practice timed bathroom visits, and strengthen pelvic floor muscles with Kegel exercises. Often, a combination of safer treatments and lifestyle changes can restore control without sacrificing your memory and overall health. Medication number 6. Statins, like Lipitor and Zocor. Statins are among the most commonly prescribed drugs in the world, and for seniors over 60, they're almost routine. These medications, including atorvastatin, Lipitor, simvastatin, Zocor, and rosuvastatin, Crestor, are designed to lower cholesterol and reduce the risk of heart attacks and strokes. On paper, that sounds like a lifesaver. But here's the hidden problem. Cholesterol isn't just a bad substance clogging your arteries. It's also a vital building block for your brain, your hormones, and the protective coating around your nerves called the myelin sheath. When cholesterol is aggressively lowered for years on end, the brain can literally be starved of the fats it needs to stay sharp, and the body may struggle to produce critical hormones that keep energy, mood, and muscles stable. In a 2023 study, published in Frontiers in Aging Neuroscience, seniors over 70 who had been on statins for more than 3 years were found to have a 26% higher risk of mild cognitive impairment compared to non-users. Even more troubling, Those on higher doses reported sudden memory lapses, difficulty recalling familiar names, and episodes of disorientation. Beyond the brain, statins can trigger muscle pain, weakness, and liver damage, all of which are often dismissed as normal aging aches. For many seniors, the trade-off becomes invisible. Yes, cholesterol numbers look better on paper, but daily life quietly declines in strength, clarity, and vitality. Better tip: if you are on statins, don't panic and don't stop them suddenly. But do ask your doctor whether the type and dose you're on is truly necessary. Not all statins affect the brain equally. Options like pravastatin and rosuvastatin are less likely to cross into the brain and may carry fewer risks for memory and mood. In addition, support your heart naturally with lifestyle strategies proven to lower cholesterol safely. Increase soluble fiber from oats, beans, and apples, add omega-3 fatty acids from fish or flax, and stay physically active with daily walking. Sometimes the right food and movement plan can reduce or even replace the need for high-dose statins, protecting both your heart and your mind. Medication number 5. Benzodiazepines, like Xanax, Valium, Ativan. For seniors struggling with anxiety, panic, or insomnia, benzodiazepines can feel like a miracle. Drugs such as alprazolam, Xanax, diazepam, Valium, and lorazepam, Ativan, are often prescribed to calm the mind, ease panic attacks, or help with sleep. At first, they seem like lifesavers. You finally rest at night, the fear quiets down, and life feels manageable again. But beneath that short-term relief lies a trap that can slowly unravel your health. Benzodiazepines work by amplifying the brain's calming chemical, GABA, essentially sedating neural activity. For younger people, this may not seem dangerous. But for seniors, whose brains are already more vulnerable, this chemical sedation can be devastating. Over time, these drugs dull reaction speed, impair balance, weaken memory, and create a fog that many mistake for aging. A 2022 study published in the BMJ followed over 8,000 seniors and found that those who used benzodiazepines for more than 3 months had a 51% higher risk of developing Alzheimer's disease. Even worse, long-acting versions like diazepam stay in the body much longer, accumulating in fatty tissues, including the brain, where they cause lasting damage. Beyond the brain, these drugs are strongly linked to falls, fractures, and hospitalizations, making them a major hidden driver of disability in older adults. And the cruelest part: when seniors try to stop, withdrawal can trigger severe anxiety, insomnia, and even tremors, creating the illusion that they need the drug to function, when in fact it is the very cause of the problem. Better tip: if you've been prescribed a benzodiazepine, don't attempt to quit suddenly. This can be dangerous. Instead, speak with your doctor about a slow tapering plan and consider alternatives like buspirone, a non-sedating anti-anxiety medication, or non-drug therapies such as cognitive behavioral therapy for insomnia and relaxation training. Gentle practices like meditation, deep breathing, and consistent sleep routines can also help reduce dependence. By stepping away from benzodiazepines safely, many seniors regain their sharpness, stability, and independence within weeks. Medication number 4. Tricyclic antidepressants, like amitriptyline and Elavil. For decades, doctors have turned to older antidepressants like amitriptyline, often sold under the brand name Elavil, not just for depression but also for chronic pain, migraines, and insomnia. Many seniors are prescribed these drugs believing they are versatile, reliable, and safe. But behind that reputation lies a serious risk. Amitriptyline belongs to a class called tricyclic antidepressants, and it has one of the strongest anticholinergic effects of any medication still commonly prescribed. That means it blocks acetylcholine, a brain chemical essential for memory, focus, and communication between nerve cells. When this chemical is disrupted, thinking slows, memory falters, and concentration fades. A massive 2015 study published In JAMA, Internal Medicine tracked over 3,400 older adults for 10 years and found that those who took higher cumulative doses of anticholinergic drugs, like amitriptyline, had a 54% greater risk of developing dementia. The tragedy is that these effects often sneak up slowly. Patients notice brain fog, difficulty finding words, or trouble concentrating, and assume it's just age, when in fact it's their medication stealing clarity day by day. Beyond the brain, tricyclic antidepressants also increase the risk of heart rhythm disturbances, dizziness, and falls, all of which can be especially dangerous for seniors living alone. In many cases, the supposed benefits of these medications are overshadowed by the very real harm they cause. Better tip: if you or a loved one is taking amitriptyline or similar drugs, ask your doctor about safer alternatives. For nerve pain, medications like duloxetine or gabapentin can often provide relief without such a heavy cognitive toll. For sleep, low-dose doxepin or melatonin may be safer choices. And for mood support, newer antidepressants like sertraline or escitalopram are generally considered more senior-friendly. Never accept brain fog as just a normal part of aging. Sometimes, it's the pill, not the years, that's stealing your sharpness. Medication number 3. SSRIs with hidden risks, like paroxetine, brand name Paxil. At first glance, selective serotonin reuptake inhibitors, or SSRIs, are considered the modern antidepressants, often thought to be gentler and safer than the older tricyclic drugs. Millions of seniors are prescribed them for depression, anxiety, or even hot flashes, and many trust that these pills are keeping their mood stable without major consequences. But not all SSRIs are the same, and one in particular, paroxetine, sold under the brand name Paxil, carries hidden dangers that most seniors are never warned about. Unlike other SSRIs, paroxetine has strong anticholinergic properties, which means it interferes with acetylcholine, the chemical critical for memory and attention. A large 2021 review published in Frontiers in Psychiatry found that elderly patients on paroxetine showed measurable declines in short-term memory, word recall, and attention span within just 12 months of use, and were nearly 30% more likely to develop early cognitive impairment compared to those on other antidepressants. The irony is devastating. A drug prescribed to stabilize mood can slowly erode mental clarity, leaving seniors foggy, forgetful, and emotionally flat. Many patients describe feeling not themselves after months on Paxil, but assume the changes are due to age or stress rather than the pill. Beyond cognition, paroxetine is also linked to weight gain, sleep disruption, and increased fall risk, which quietly add to the burden on senior health. Better tip: if you or someone you love is taking paroxetine, don't stop suddenly, but do ask your doctor about switching to safer SSRIs such as sertraline, Zoloft, or escitalopram, Lexapro, which do not carry the same anticholinergic burden. Alongside medication changes, supporting brain health with B vitamins, especially B12 and B6, and omega-3 fatty acids, can help restore energy and focus. Remember, the goal of treating depression or anxiety should never come at the cost of your memory and independence, and safer options are available if you ask for them. Medication number 2. Antipsychotics, like Seroquel, Risperdal, Zyprexa. Originally designed for serious psychiatric illnesses such as schizophrenia and bipolar disorder, antipsychotic drugs like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, are now frequently prescribed to seniors for reasons far outside their intended use. In nursing homes and even at home, these drugs are often given to older adults who struggle with agitation, insomnia, or behavioral changes, sometimes linked to dementia itself. Families are told they will calm their loved one, but the truth is much darker. These medications work by suppressing dopamine, a key brain chemical that controls motivation, movement, and memory. When dopamine is blunted, seniors can appear emotionally flat, sluggish, and disconnected, almost like a shadow of themselves. A 2022 study published in The Lancet Healthy Longevity tracked over 25,000 seniors and found that those given antipsychotics for behavioral issues had a 71% faster progression of cognitive decline within 12 months, even if they had no prior history of dementia. Beyond mental function, antipsychotics drastically raise the risk of strokes, sudden death, and dangerous falls, often leading to hospitalization or permanent disability. Families sometimes mistake this decline for the disease getting worse, when in fact it is the medication itself stealing vitality. What makes it worse is that many seniors are never told they are even taking an antipsychotic. They are simply handed a pill for sleep or restlessness, while the long-term costs remain hidden. Better tip: if you or a loved one has been prescribed an antipsychotic, ask the doctor directly why it was chosen and whether non-drug approaches could be tried first. Often, agitation or confusion in seniors can be managed by improving sleep. Routines, addressing pain, reducing noise or overstimulation, or adjusting the environment. When medication is absolutely necessary, using the lowest possible dose for the shortest possible time can reduce harm. Don't accept a prescription without fully understanding its purpose. Your brain and body deserve protection, not sedation. Medication number 1, the hidden danger of polypharmacy, taking multiple drugs at once. The single most dangerous threat to senior health isn't always one pill by itself. It's the silent accumulation of many medications taken together, a situation known as polypharmacy. Imagine this. A senior takes ibuprofen for pain, a proton pump inhibitor for acid reflux, oxybutynin for bladder control, and amitriptyline for sleep. Each drug may seem manageable on its own, but combined, their side effects multiply, creating a toxic storm inside the body. The risks include dizziness, confusion, dangerous falls, organ damage, and a sharply higher chance of hospitalization. A 2022 analysis published in Age and Aging tracked over 280,000 older adults and found that those on multiple medications had more than double the risk of death and disability within 10 years compared to those on fewer drugs. Even more alarming, most seniors have no idea they are caught in this cycle because different doctors often prescribe without checking the full picture. Over time, the body struggles to process so many chemicals at once. The liver and kidneys weaken, the brain slows, and quality of life erodes. What looks like just getting older may actually be the direct result of medication overload. Better tip: protect yourself by asking your doctor or pharmacist for a full medication review at least once a year. Bring every prescription, over-the-counter pill, and supplement you take, and request an evaluation of interactions and cumulative burden. Sometimes 2 or 3 drugs can be replaced by one safer alternative, or unnecessary medications can be slowly tapered away. Keeping your list of medications short, clear, and essential is one of the most powerful ways to extend both your lifespan and your independence. Remember, more pills rarely mean better health. Often, less is truly more. Now you can see the truth. Some of the very pills meant to help seniors are quietly destroying health, energy, and independence. But here's the good news. Many of these effects are preventable, and in some cases even reversible if you take action now. The most powerful step you can take is to question, review, and reduce unnecessary medications before they steal more of your golden years. Remember, aging does not have to mean weakness, fog, or constant illness. Sometimes, it's not age at all, but the medicine cabinet. Now we want to hear from you. Which of these medications are you currently taking? Have you noticed sudden fatigue, brain fog, dizziness, or other strange symptoms since starting a new prescription? And most importantly, are you willing to ask your doctor this week for a full medication review? Share your story in the comments below. Your experience could save another senior's life.